Welcome back to the Senior Focus. Again, I'm your host, Nick Kaltzis. Lindsay Quillen's still here with me, and Kristen Cooney joins us.
Thank you.
How are you?
Thrilled, happy to be here. I am doing very well. How about you?
I am doing very well
Fantastic.
as well. So we're going to talk about Medicare.
We are.
Medicare is an important benefit.
It is. And it is the open enrollment time. I'm sure people are aware of. They're getting things in the mail.
What is the open enrollment time?
Open enrollment is a period of time that Medicare allows Medicare beneficiaries to make changes to their existing plans. And it starts October 15th and it runs through December 7th, and it happens the same time every year. And everyone who has either a supplement or a prescription drug plan or a Medicare Advantage plan with a drug plan has the opportunity to take a look at what they have and what's available in the open marketplace for them. So,
Well, Lindsay, let me ask you, what if someone doesn't have a plan? What if they don't have Medicare? But as we said, if you're eligible for Medicare and you opt not to take it and you don't have creditable coverage in place, not a good thing, right?
Right. Well, you're actually asking two different things. With annual election period is time for people who currently are on Medicare, who have coverage, to be able to make any change they want to their existing coverage, as you'd mentioned. For individuals who haven't been on Medicare and who opted to not get their coverage just yet, whether they were still working or they just decided they didn't need Medicare just yet for a lot of different reasons. Unfortunately, people fall into that gap, and there's a different enrollment period or special enrollment period called the general election period from January 1st to March 31st each year for those individuals.
Now, Kristen, what's the difference between Medicaid and Medicare? Is there a difference?
there is. And people use the words interchangeably to mean Medicare a lot of
It's
times.
very confusing.
It is.
Maybe it's not as confusing for us, but for them it's
Yes.
It's frustrating when you talk with people, you explain which particular program or what benefit they're entitled to, why they're entitled to it, and they just seem to have a disconnect between the terms Medicare and Medicaid. They do. They use them interchangeably.
They do.
But they are not an interchangeable program, are they?
Completely different. Yeah. So Medicare, as you know, is an insurance, or it is an insurance, but it's for people who are 65.
Yeah.
Most people, you can get Medicare under 65 if you are disabled, but for most people, you're turning 65. Mm-hmm. If you've worked 40 quarters or 10 years, you've paid into the Medicare so that you can get your Part A and your Part B.
So you're insurable.
Turning 60, you are insurable.
Right.
Yes. Medicaid is for all ages, and you typically are getting it through a combination of federal and state assistance, but you're primarily applying for it through the state.
So Medicare, we'll say, is 100% federal. Medicaid is essentially a 50-50 split, half federal, half state.
They are both involved, yes.
Administered by the state.
Correct. And like I said, from birth all the way up. I mean, you can apply for Medicaid or Mass Health as a Medicare beneficiary and get both of those benefits. But it is income asset determined, and probably a percentage of the poverty level where they determine if you're eligible.
I'll tell you, Mass Health is just brutal today.
Is it?
I personally think they are completely unreasonable, but maybe others would disagree.
No, I feel the same way.
I understand that, fiscally, budget-wise, there isn't, sufficient resources to go around, I understand. But they've made the eligibility requirements, really difficult. And even when a person satisfies the eligibility requirements, it's kind of like Social Security, right? Keep on denying, make them go into the process. And the further in the process you go, the more likely you are to get your benefits.
Right.
Mass Health is the same way now.
Right. I just wanted to elaborate on something that Lindsay had mentioned during the general enrollment time. She is correct. You can enroll generally from January 1 to the 31st, but you wouldn't be effective until July 1st.
Okay.
Even though you can jump in then if you've missed all your opportunity to enroll, the effectiveness of your Medicare A and B is not until July 1.
So if your birthday is May 15th.
So you have a 7-month window
Yeah.
that Medicare allows you to enroll in A and B.
Okay, so
If you've gone, let's say you've gone past that window,
all right,
you've
let's
enrolled in
say
nothing.
that someone was born May 15th.
They would be effective May 1st.
Okay.
It's always the first of the month, not
Okay.
the date of your birth.
Okay, so when they decide that, okay, this is for me, I want to join, what period of time do they have after they turn 65 to be able to opt into the program? Or should they opt in even before they're 65?
Before that.
Yeah, so if they are going to use their Medicare benefits, their Part A and their Part B, and they're going to be 65 in May, then they can enroll 3 months prior to a May 1st effective date
Right.
to get your Medicare activated A and B for May 1. Then you have the month of turning 65 and then 3 months after.
Okay.
So it's a 7-month window to get into your Medicare.
And that window is both before,
3
during
months
the birthday,
before, month
and-
of, and 3 after.
Right.
Correct.
You
If
know-
you've missed that,
Yeah.
and you didn't have what you're talking about, a credible
In
coverage
place,
through an
right,
spouse or
right.
through your own employment, and you've let that window go by, then as Lindsay said, January 1 to March 31, you can enroll in the general enrollment with an effective date of July 1st of that given year that you've enrolled.
Very confusing, you know.
And
It's-
there's
it's if
also
you-
more to that as well, as you
Yeah.
were saying, that part of that, the delay is part of the penalty for not enrolling in a time that you should,
Right.
quote unquote, should have.
Right.
But there are a lot of factors that will figure into who should, who shouldn't, why you could or couldn't,
Right.
and looking at when you
Right.
want to line that up for
You know,
effective
just like
dates.
when I was talking to Liz and I said, you know, it makes no sense really for someone to decide, well, you know what, I want to maintain my independence. I don't want to accept help. I'm going to like do everything on my own. And they just don't accept help. They try to do it on their own until, you know, maybe a catastrophe happens and
Right.
they no longer can do it. I view this as the same.
Right.
A person can look at this and say, oh man, this is complicated.
Right.
Their eyes glaze over. And
It's a lot.
yeah,
Yes.
maybe they just say, hey, I'm going to put this off. I'll do it tomorrow. I'll do it next week. I'll do it next week. All of a sudden, they're beyond the period when they should have joined. But there are agencies, companies out there that can help them, aren't there, Lindsay?
Yes. As Medicare mentors, we were talking about this before the show, I am an insurance advisor here in Massachusetts, a licensed health insurance advisor. So I'm not an agent or a broker, so I'm not representing any insurance company. Medicare Mentors is there to truly help individuals to understand the options that are available to them and the benefits that are there for them to begin with. So I feel it's really important to make informed decisions that you understand what your coverage is supposed to look like under Medicare, and then to understand what the gaps could be, what the coverage will entail through prescription drugs or a Medicare Advantage plan, but to help people to understand the many options that are going to be available every year, but that they change every year as well. Just like all of our needs change, our health conditions change, our financial resources change, our desires for coverage changes from year to year. In 2015, we're going to have over 82 Medicare Advantage plans total across the state of Massachusetts, or Commonwealth of Massachusetts, and 27 different prescription drug plans to choose from. So there's a lot of looking at plans and coverage options and seeing what's going to fit right for you. It's not a one-size-fits-all. We can't listen to Uncle Harry down the street that says, oh, this is the best plan for me, you should get into it too. Some people that'll work, but I can tell you from my own experience working with couples even, the best plan or coverage option for one might be really financially difficult for the other person to keep up with because it's not going to be the best coverage necessarily.
Now, as far as, I mean, you hear Medicare Part A, Medicare Part B, Part C, Part D. There's different programs, right?
Well, A, is this to me? Would you like me
Yeah,
to?
sure,
Okay,
I would.
so-
We'll share together.
I
We were in there.
always talking.
It's great.
Yeah,
all
I'm
right.
trying to be judicious.
The A and the B come from Medicare.
Right.
A is your hospital coverage, B is called medical. So it's your services outside of the hospital.
Okay.
A Part C plan,
All right, before you continue, okay. A
Part A
is
is hospital coverage.
B is outside the hospital.
correct, called medical.
Okay.
Okay?
Traditional Medicare, if you
Yes.
will.
See, it
I
is
like that.
confusing. I just want to make sure I'm
Yes.
getting it right. Okay.
So if you look at that as an insurance option, using your Part A and your Part B, the
Right.
cost of that for most people is $104.90 a month for this year, because it does get adjusted, and it's for your Part B, the medical piece to it.
Where did they take that $104
Well,
from?
they'll take it from your Social Security retirement money if you're collecting
Okay.
Social Security. If you're deferring, which a lot of people are, so that they can get more,
Sure.
they'll bill you quarterly for that 104.90, so
Okay.
that you'll have the B effective.
I see.
So you don't have to take your Social Security money in order to get your Medicare, and then you have those two ways to pay for that.
But even if you're not accepting or you're not taking your Social Security benefit, you can't delay Medicare.
Oh,
I mean,
sure.
you can opt not to take it, but if there's no penalty with delaying Social Security, but there would be a penalty if you're entitled to Medicare,
Right,
don't have credible coverage, and decide,
And
you know
don't
what,
get the
I'm
B.
not going to get it yet.
correct.
And the creditable coverage for Part B is going to be that you or your spouse is actively employed and covered through an employee group health plan. If you don't have that active employment in place, whether it's through yourself or through a spouse, you're still facing a penalty if you don't
Or
choose to
maybe
enroll in
a
Medicare at
COBRA
that time.
plan or something like that, right? No?
COBRA's
Yes?
deadly over there.
Yeah, it's costly.
Yeah.
A lot of
very
times it can be
costly.
less costly for you
Right.
to get your Part B, pay that premium, and find another plan
Yeah.
than it is to pay the COBRA premiums.
And COBRA for Medicare A and B is actually not comparable coverage to Medicare A and B. The prescription drug coverage can be comparable or creditable coverage to prescription drug Part D, but not for Medicare Part B. If you have COBRA coverage in place, that's not going to help to delay enrolling in Medicare Part B without there being a penalty in the future.
As far as someone out there thinking, what is COBRA coverage? I suppose in a nutshell, we can say that if a person was employed, they had their insurance, at one point we'll say insurance was employer-based, so, companies could use the offering of insurance plans and benefits as an incentive to get people to work for them. And in the event you lost your job, you could keep your insurance going through COBRA. And you're right, it's extraordinarily expensive. In any event, we're going to have to head to a break right now. Lindsay, I want to thank you for joining us today.
Pleasure. Thank you.
And when we come back, more Senior Focus with Kristen Cooney.